So I am Tyriesa Howard. I am an assistant professor at the Brown School at Washington University in St. Louis, and my research broadly covers sexual, reproductive, and maternal health disparities for Black people living in the U.S. And I am interested in this work, and I came to do this sort of work based off of both personal and professional reasons. I started to see increased trends of maternal health, mortality and morbidity rates that were impacting people who looked like me. It became a common conversation within my friend group. And because I was already invested in sexual health research and education that included HIV prevention, I opted to also look at ways that I could be one of the scholars who is interested in figuring out how to address and eradicate the maternal mortality and morbidity issues that we also see. And so that really enhanced in me a desire to see what are the gaps that can be identified and how can I address those gaps through my science. And so I was able to build incredible connections with one of my colleagues, Dr. Jesse Davis, and WashU School of Medicine, who is a NICU hospitalist. And he was noticing that there was a disengagement from dads in particular in the hospital. And so there were not a lot of conversations being had with the fathers in terms of their well-being as well as the well-being of the critically ill newborns. And so together we started to discuss ways that we can approach practice and service models in the NICU to improve and enhance family-centered care within NICU settings. And so from that point, I have consistently worked to build this really great and intentional model of engaging NICU dads to moderate those improved outcomes for NICU moms and babies. And I am just so excited to be able to do that work in this space, and to be able to create meaningful impact for the communities that we serve. The Brown School at Washington University is driven by a mission that really emphasizes social justice, interdisciplinary public health, and social work and equity. And I think that the goals to focus on really creating positive societal impact through our research, through our education, as well as the engagement with the community has been really foundational for supporting me in my role as a scholar, as someone who is interested in addressing really complex social, health, and economic issues that impact sexual, reproductive, and maternal health disparities that primarily impact Black people living in the U.S. And so I think that the mission and the goals really resonate with me and have provided an incredibly supportive foundation for me to do this work with academic freedom. And so I would say that when addressing things like inequities in birth and birth outcomes, being able to be in a community of scholars who understand the significance of being able to address health disparities has really been valuable for my success in being able to do so. I think our commitment here aligns directly with my work in reproductive justice and maternal health, and that I am able to really build and leverage important partnerships with our community locally here to do a lot of the work and to make a lot of the connections that I am doing in terms of the work. And so for me personally, my work is really community driven, and I'm a person who's incredibly concerned about the social environment which within what that I'm situated in and how that literally impacts the ways that the universities have partnerships and have this sort of engaged, reciprocated relationship with the people in St. Louis. And so I have been really excited to build those relationships and to also bring them along and support what their specific goals look like as well beyond my own as an academic and scholar. And I think having this community center interdisciplinary approach and having that supported here has been really helpful in supporting me as a scholar who's really concerned about being able to address and eradicate issues and health disparities that impact marginalized communities. Overall, I think that this platform for advocacy is something that builds and supports broader implications for policy-based impacts and really supports a translation of your science into aspects of practice and to aspects of legislation that can help improve a lot of the issues that we currently see here now. So I would just overall say that I have been encouraged to be able to be bold and novel in my scholarly innovation and inquiry. And I think that this is an amazing place and a great environment to be able to do so.